Sittings resumed. Question 8 has been withdrawn. So questions to the Minister of Health. I call David Brooks. Minister.
Percutaneous endoscopic gastrostomy insertion for children and young people is a very complex procedure. It requires specialist clinical and nursing input, that is prior to, during and post-procedure. Officials have been working with Belfast Trust to identify measures in order to address this. The Trust scheduled additional clinics and theatre sessions to reduce paediatric waiting times, and additional PEG procedures have occurred. The Trust now have weekly lists to carry out PEG insertions. Belfast Trust explored the potential for another NHS body to carry out the procedure and indeed approached the private sector to see if we could address some of the backlog. An NHS provider has outlined they will be able to carry out some procedures. South Eastern Trust are also in position to carry out some less complex procedures. However, the private sector is not an option. I assure members, officials in the department as well as colleagues in Belfast Trust are working hard to deal with the issue, but given the ongoing pressures on the service and demand for theatre capacity, this will mean this will not be solved immediately. We'll continue to assess and gauge progress, the aim to ensure all children and young people receive the care they require as quickly as possible. The actions that have happened and are planned are having tangible impacts on the waiting list.
Assembly Chamber. Sound. 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 Assembly Chamber. Sound.
Jonathan Buckley.
Microphones are working just yet. Oh, they are now. Minister, whilst the Regional Trauma Network has played an important role in supporting victims and survivors of the Troubles, can the Minister provide his view on whether the network's current capacity and resources are adequate to meet the needs of those affected, especially in light of the complex and long-term nature of the trauma experienced by those victims during Northern Ireland's Troubles?
Minister.
Well, as I was saying, the RTN was set up specifically for victims and survivors of the conflict, and it was agreed during the Stormont House talks by Martin McGuinness, by Peter Robinson, by all the party leaders involved in those talks. But then officials made the point that the National Health Service has to be open to all. And you can't have an NHS or an HSC service which is limited to a specific number of people. And so the compromise was to have this first phase, which is to run for a minimum of 3 years, phase 1 being specifically targeted at victims and survivors of the conflict. They have a waiting list, and I think that answers the member's question in that the capacity is not there to deal with every single victim and survivor who wants to come forward and ask for help in terms of the trauma that they suffered and continue to suffer as a consequence of the conflict. But could you put that resource in place? I think it would be just too big an ask. And on top of that, at some point there has to be a phase 2, which opens it up further to comply with what the officials were saying back in the day, that you cannot have a National Health Service that is limited to a specific group of the population. The phase 1, that period of at least three years, it takes us just to April of next year, so we're only kind of 12 months away from a decision. But I think the decision doesn't have to be to just open it up to everybody. I think we may look at a graduated move towards opening it up because, to get back to the member's question, the capacity is always going to struggle to meet demand.
2 minutes is up. Minister Orley Flynn.
Thank the Minister for those answers. So, Minister, in terms of phase 2 approaching, would he be confident that the Regional Trauma Network could be protected for the people that it was designed for, which is victims and survivors? And it's something I raised with the Deputy First Minister the other day in terms of the wider victims strategy also.
Well, I thank the member for her question. I very much acknowledge her ongoing interest in this area and in the broad field of mental health, suicide prevention. As I say, I think April 2023 is the appropriate time to start the clock on phase 1. So April 26 is the period when 3 years are up. But I go back to the fact it is a period of at least 3 years, not of 3 years. And certainly in talking to those groups, Relatives for Justice, the Ely Centre, South East Fermanagh Federation, the 6 or 7 groups who were always involved in the co-design of this, extreme concern. I would not put it I don't think that's over-egging it to say there is extreme concern about opening it up and therefore diluting it in terms of what it can do for their service users. So I'm very aware of that, and I will work hard to try and protect it, because it was my idea, and the idea was to work for the victims and survivors of the conflict.
Justin McNulty.
Which can't call it. Thank God your mic is now working. No pun intended. Boom, boom. Minister, we are told that many young people aged 18 to 24 are experiencing trauma resulting from threats, violence and paramilitary threats. This isn't a legacy issue. This is now. What work has been done with the Justice Minister to prevent such violence and support these young people who have been affected?
Minister.
I think I'm suffering from trauma from your sense of humour. We have a number of strategies in play. If you were referring particularly to people suffering trauma and indeed community coercive control as a result of paramilitary groups, is that where you are? Then yes, well, there's tackling paramilitarism. There's a lot happening. Justice is leading on it, but I think it is a whole executive response. I mean, I represent the town of Newtownards, very proud to represent it. Some fantastic people live in that town, but I also have to accept, if you go down there and you look at the murals, every shade of loyalist paramilitarism is represented there. And I am aware, particularly in the concentrated housing areas like the West Winds and some of those other areas, that there is coercive control going on from paramilitary groups. And they've been on ceasefire for over 30 years, which means they've been on ceasefire longer than they were active, not that they should ever have been active. So the question remains, why do they still exist 30 years after they declared ceasefires? And they exist for a number of reasons. And it's some people lining their pockets, and it's other people exercising that coercive control over communities that I represent, that many people in this House represent, and it's time to stop it. So we cannot exercise ourselves in terms of what we do to try and give the people who live in towns like Newtownards the ability to grow up, live and express themselves and enjoy themselves as freely as possible.
Declan McAleer.
Question 4.
Minister.
I thank the member for his ongoing interest. I'm aware of the frustrations and the concerns being raised locally, and he is getting that in his office. I met with the GP partners and their staff at the health centre in Carrickmore back in December, 4th of December last. I fully recognise that there is a huge need to invest in primary care to support the reform agenda and to stabilise primary care. Capital investments required to modernise and maintain that service and to ensure the estate's fit for purpose to enable service delivery. Now, since financial year 2018-19, around 38 million of capital has been invested through the Primary Care Infrastructure Development Programme, that's in GP premises, and that includes investment in accommodation for primary care multidisciplinary team purposes. Carrickmore is a large practice, 5 GPs, practice support staff, approximately 10,000 patients. And due to the growing size, it's now operating out of a space which is below its capacity requirements and indeed below the Department of Health recommended schedules of accommodation for a practice of that size. Approximately 70,000 has been invested in the existing premises in the last financial year, 24-25. That, of course, is only an interim solution to address immediate pressures. Work has also commenced to address the longer-term needs of the practice, and that's in the form, potentially, of a new build. Initial engagement commenced in October last year between my department, the Western Trust and the Carrickmore practice, and they have begun together to scope the project. It will be subject, of course, to the usual business case approvals. Timing will be dependent on the outcome of that process and, of course, approval of funding through the department's overarching capital plan. But I would be keen that we move towards a new build for Carrickmore.
Mr. McAleer.
I welcome the Minister's response, and I also welcome the fact that he took the time to come to Carrickmore. And you know, Minister, this is a very vast rural area which brings a lot of issues to do with isolation and accessibility. And I suppose the question that what people would ask me is, Minister, what would be the timeline? What's the next steps, and what would be the timeline when we might see capital investment and hopefully a new build in Carrickmore of a new health centre?
Minister.
Well, I just want to emphasise, I did go in December. Great people, very dedicated people, but working in a building which is long past being fit for purpose. Don't have enough space, rooms are too small, they're just making do. And I do say, you need buildings, you need equipment, you need medicines and workforce, and I always prioritise the workforce, but in this case the building just is not good enough. So we're currently at the very start of scoping the project, so I'm afraid it will be a number of years before the building will be delivered, and that's based on similar schemes that leads me to conclude it could be the region of 3 to 5 years. Timing will be dependent on a number of factors, as you can imagine: site availability, ease of obtaining planning permission, tendered costs, everything being affordable within our capital budget. So I'm not in a position to provide a cost estimate at this point. Definitive timings, definitive costs depend on the outcome of the engagement on the design process and confirmation on the availability of funding through our capital plan. But the project will be subject to the usual business case approvals, and that will include any potential revenue costs as well as the capital. But I am very much minded, I would very much like to see a successful and a speedy completion of this project.
Neil McLaughlin.
Number 5, please.
Minister.
The Patient Safety Commissioner for England, Dr. Henrietta Hughes, made recommendations on redress for those who were harmed by both pelvic mesh implants and the medicine sodium valproate in the Hughes report. The Hughes report was published on the 7th of February last. Dr. Hughes's remit was specifically for England, but it's acknowledged patients from across the UK have been affected by these issues. The 3 devolved administrations are awaiting consideration and assessment from the Department of Health and Social Care in London. However, the UK Government has not yet formally responded to the Hughes report, and a UK Government decision on redress has not been taken. I very much regret that those who have been harmed by both pelvic mesh and sodium valproate have had to wait so long on clarity around the way forward in response to that report. I wrote to Baroness Merrin, who's the Parliamentary Under-Secretary of State for Patient Safety, Women's Health and Mental Health at the DHSC, and I requested an update on the consideration of the Hughes report recommendations, and I've sought assurances that consultation with the devolved administrations will take place in a timely manner and in advance of any UK Government decisions. Baroness Merrin responded the UK Government is carefully considering the report, and that's before coming to a decision. She recognises any response by the UK Government is likely to have implications for the devolved administrations, and she said she's keen to work closely with officials right across the UK in considering the report's recommendations. She's provided assurance that my officials and I will be engaged in a timely manner and in advance of any UK Government response. The approach to redress in Northern Ireland will be informed by the UK Government position, and as I say, that is not yet determined.
Ms. McLaughlin.
Thank you, Minister, for your answer. As you know, lives have been devastated by the complications of the vaginal mesh. One of my constituents is facing up to almost £30,000 to access mesh removal, a burden that is financially and emotionally crippling. In light of cases like this, will you commit to commissioning a review into the care and support available to women harmed by vaginal mesh to ensure that they have safe, accessible and fully funded pathways to have the mesh removed?
Minister.
I thank the member for her follow-up question and her concern, which I would share. The numbers in Northern Ireland have to be determined. And, I'm not hiding behind the fact that we're waiting for the Department of Health in London to respond definitively to the Hughes report. But I think it's important that the 4 devolved administrations go forward together on this, because I think if you start doing things differently, then you sow potentially the seeds of division amongst people who are suffering in England, Scotland, Wales and here. So I'm very open to what the member is suggesting, and I will make that part of my consideration. But I'm afraid I think that the next step is to wait for the UK Government to respond to Hughes.
Dan Armstrong.
Thank you, Minister, for your response. Minister, a group sometimes overlooked on the issue of surgical mesh are men. Can you detail what engagement there has been to address the issue of hernia mesh?
Half a minute, Minister.
I need half a minute to get to the answer here, Mr. Speaker. I thank the member for her question. We've been engaging with the campaign group Hernia Mesh Awareness NI in relation to the Hughes report on redress, and this includes surgical mesh for men. So I would like to assure the member that it is on our, not just on our agenda, but action is being taken to scope out and to understand and to react appropriately to those men who have suffered in this area.
Moving on to topical questions, call Colin McGrath.
Mr. Speaker, I wish to acknowledge the hard work and dedication and bravery of our whole time, and especially retained firefighters from across the Mournes and beyond, in particular Newcastle, Kilkeel, Downpatrick, Warrenpoint and Rathryland in my constituency, who have fought and are fighting the gorse fires that have occurred over the past week. Would you join me, Minister, in commending their commitment and bravery in putting out the fires and protecting our communities and our natural environment?
Minister.
I very much welcome the opportunity to join the member in paying tribute to the members of the Northern Ireland Fire and Rescue Service who have been tireless in recent days, manually beating down the fires in the Mournes. I will visit them. I do want to go and show my appreciation and my admiration for them. But as this situation is still live, I think it would be inappropriate, it would in fact be a distraction if I were to go down in my ministerial capacity at this stage. But that should not diminish from my absolute gratitude for what they've done to protect life and to try and preserve that very important area of Northern Ireland.
McGrath.
The Minister agree with me that after the last set of wildfires in the Mournes in 2021, we were promised a wildfire management plan and a Mournes wildfire strategy, which were to be delivered between the Departments of Finance and the Departments of Agriculture, and that the lack of progress on these matters has literally fuelled the fire and put our firefighters, our communities and our natural environment at grave risk.
Minister.
The member for his follow-up. I'm not sure I would agree that it has fuelled the fire, but I do think, like I'm sure every member of this House, we would like to see a wildfire management plan, a wildfire management strategy, and I know that the current Minister in the Department of Agriculture, Environment and Rural Affairs shares that ambition, and I think is pressing officials to bring forward proposals. I know he has had a particular difficulty in that nobody tendered in terms of delivering the wildfire management plan. But it's not as if nothing has happened. I think the NIEA have had new vehicles which have been helping to tackle the fires in the Mournes today. You point out many, many times that there's disagreement between members of executive parties in this chamber, so I don't think it's my responsibility to criticise any other executive member. That falls to yourself, Mr. McGrath, as a member of the opposition. But I do agree it would be nice to see those things executed after all these years, and I have faith that the Minister, Indira, will actually do that.
Kelly Armstrong.
Speaker, and thank you, Minister. Minister, as you know, family practitioners like GPs, community pharmacists, dentists and opticians, I'm not going to say the other word, have estimated that the increases to the employer's national insurance contributions and minimum wages for this year will be £36.5 million, and that you have been allocated there has been an allocation of £3.5 million to assist with that. I believe at last Thursday's Health Committee you'd mentioned that you were going to try to make up the shortfall. How do you intend to do that?
Minister.
Well, thank the member for her question. I'm very sympathetic to this because this was an unexpected and additional burden that has been placed on opticians, GPs, pharmacists and the rest. And yes, within the budget, the Minister for Finance has informed me that £3.5 million is being contributed to what we think is going to be a £36 million challenge. That's within the broader challenge where we still believe that despite the additional money, the extra 50 million for waiting lists, that the overall budget for the Department of Health is around £400 million short of what we need in terms of delivering all services. But that means there are going to have to be priorities, there are going to have to be decisions made. And once again, I return to the fact that without a workforce, everything else is as nothing. And so for me to try and do everything I can to try and close that gap in terms of the additional costs of national insurance is something that I want to do before I do many other things.
I think ophthalmologist is the word you're looking for. So, Ms Armstrong.
Thank you, Mr. Speaker. You're absolutely right. Minister, thank you for your answer. But do you accept that the Department of Health is effectively asking then GPs, pharmacists, pharmacy owners, dentists and opticians to absorb the cost, and actually they're going to close the gap through personal finances?
I'm afraid you failed in your audition to become Health Minister, but that's the way it goes. I don't accept that at the moment because I think it is just too early. We're still in the foothills of how we're going to carve out the health budget, because it is, after all, over £8.4 billion. And despite the fact there's a £400 million gap, and I don't wish to underestimate the severity of that, I tend to be a glass half full sort of person. And I will be working with the new Permanent Secretary and with senior members of staff within the department, senior officials, to see what can be done. And certainly trying to avoid individuals having to put their hand in their own pocket to cover these costs is a motivation for me.
Deborah Erskine.
And I thank the Minister for his answer so far. Following on from Ms Armstrong's question, this is an important issue because this will affect everybody here in Northern Ireland, because in this chamber we've talked quite a bit of shrinkages that may be happening with practices, and I want to ask specifically, when will support kick in from your department? Have you taken their case to the Treasury, and have you been working with your counterparts elsewhere in the rest of the UK to make sure that, that the issue is dealt with fully?
Thank the member for her question. What I did was write to Wes Streeting, the Secretary of State at the Department of Health and Social Care, and also communicated with the then Finance Minister, Kiva Archibald. So I think there, and indeed the three devolved administrations in Wales, Scotland and here have been liaising. So yes, I think there is a concerted approach to try and make the Treasury aware of just how serious this is, particularly in primary and community care.
Mrs Erskine.
Thank the Minister for his answer. Community pharmacy and primary care, as I have said, is very important for everybody. The Minister will remember I did do an adjournment debate on the shrinkage within NHS dentistry in Fermanagh and South Tyrone. We could see further shrinkage and decline and closure. Has your department done any assessment of what this will mean for rural constituencies like mine in Fermanagh and South Tyrone, where health inequalities are actually higher for many different factors?
Minister.
Well, the member will be aware that tackling health inequalities is a key focus for me. It is something that I have communicated to officials and more broadly in the health and social care system, and I think it has been very well received. So we are starting within two urban areas in terms of the demonstration areas for Live Better, but that is because that is the easiest way to trap the empirical evidence which will allow us to validate what I am intending to do, and then to tackle the deeper challenge of making it work in rural areas. I don't want to see a single community pharmacist closed. I don't want to see one more GP practice hand back their contract, and that is a particular challenge in rural areas, and I would assure the member there's an appropriate focus being put on that by departmental officials and by the trusts.
Nick Matheson.
Thank you, Mr Speaker. The Minister attended an event recently here organised by patients with facial palsy, and there were many clinicians in attendance as well, setting out the challenges of delivering services here for that condition in Northern Ireland. Can the Minister outline what steps are being taken to deliver a facial palsy pathway in Northern Ireland?
I thank the member for his comments, and I note his contribution to that event which I attended In the Long Gallery, a new facial palsy regional planning group was established in September 2023, and they've developed a pathway for local services, both for adults and children. It's been a complex process with multiple services involved in the pathway development, because the pathways need to be multiple, and multiple access points into the service across all trusts. These standardised pathways will ensure appropriate treatment of patients in local services as far as possible. It will also outline the appropriate referral pathway for those who require more enhanced and specialist intervention. Communication is being issued to each trust in the coming weeks, and that will inform them of the agreed pathway, and an information webinar will be delivered to GPs and emergency departments to aid with timely and appropriate referral. In addition, to assist patients who are experiencing facial palsy symptoms, a new NI Direct webpage has also recently been established, and this will signpost patients to helpful information while they're waiting for an assessment. A video has also been produced by a service user advocate, which has been used on social media platforms to promote the new Northern Ireland Direct webpage.
Mr. Matheson.
And I thank the Minister for his answer, and he has alluded to the fact that this has been a long and complicated process. It is a complex condition, but given that, it is my understanding that previously funding had been released to the South Eastern Health and Social Care Trust to deliver an InReach service from GB to support patients in the interim. But as yet, I'm not aware of that service ever having been established. Can the Minister provide any background to that and provide any assurances that that is still something on his department's agenda?
Minister.
What I can say to the member is that on average it's only 3 to 5 patients who are assessed as suitable for surgery every year here in Northern Ireland. And those referrals are managed through the South Eastern Health and Social Care Trust as part of a network arrangement with a specialist provider in Great Britain. The activity represents a very small component of the care pathway for facial palsy. The majority of patients are managed locally across the trusts. InReach services are provided as part of the total commissioning arrangement for plastic surgery provided annually to the South Eastern Trust. Most of the facial palsy assessment and treatment is provided locally through the local hospital specialties. But for those patients requiring specialist surgical Botox treatment, SPPG send most of these patients to the United Kingdom, and that's via an extra contractual arrangement, an ECR. If that does not answer the member's question, I'm more than happy to accept a follow-up in writing.
Orla Flynn.
Can the Minister clarify? I know he sent a letter out to committee members yesterday around the budget for the waiting lists, if he's given any consideration to the cross-border directive?
Minister.
I most certainly have, yes. So there's £215 million broken into 3 pots of money, 85 million for red flag cancer and urgent, then 80 million which is to stop the waiting lists growing any larger effectively. So that's 165 of the 215. That is coming out of my budget. It's being ring-fenced by the executive. And tackling waiting lists is an executive priority. I've no difficulty with that because I agree with it. And then I'm getting another 50 million in June monitoring if I can provide the right plan. And I accept I need to be able to justify that spend. To tackle the waiting lists this financial year, it has to be a cocktail. So there will be work that will be carried out by the Health and Social Care Trusts. We will do it within the HSC system. Secondly, we will have to look to independent providers. And thirdly, we will look to reinstate a cross-border scheme. And we will be doing all that at pace, and I will be meeting officials in the coming days to look at an options paper that they are preparing for me in that regard. I would just put in this proviso because I know many members like the cross-border scheme, very popular, but remember patients have to pay up front and then get reimbursed by the department. So there is an equity issue there that I am concerned about and that I want to see what might be done, with no guarantees, to try and mitigate the fact that there might be those who actually can't afford or can't find the means to find the money for the upfront payment. But perhaps we can just deal with them through one of the other pathways that we're going to be creating.
Ms. Flynn.
Thanks very much for that response, and I'm delighted to hear the work that you're undertaking with the trusts and the other providers. The options paper that you spoke about there, I don't know if you said it's going to be ready maybe in a number of days or weeks. Would that be something that the Minister could share with the committee or other members?
I'm more than happy to share the paper with the committee at the appropriate time. I think the paper is coming to me to facilitate a meeting next week. I'm not sure which day of the week. So I can't really say, because I haven't seen it yet, am I just going to say that's perfect, let's sign it off, or whether I'm going to ask officials to go away and do a bit more work. I would rather it comes to the committee as a pretty definitive, here is our plan, what the committee members think of that, and can you advise and assist me on how we might make it better. But we also want to proceed at pace. So the cross-border scheme, I'm being told, you know, if we start next week, it could be another 6 to 8 weeks before we're putting it in place where we start the machinery rocking. That's getting well into this financial year, and like people who are on a waiting list, I'm pretty impatient to get this done.
That concludes questions to the Minister for Health. An unusual one it was. If members would just take their ease for a moment or two whilst we change the chair for the next item of business.